If you are turning 65 or helping someone who is, Medicare can feel confusing very quickly. There are so many letters, plans, and deadlines that many people don't know where to begin. Today, I'm going to explain Medicare basics in a simple way so you understand what it is and what it is not. Welcome to Simply Senior Plans. We help you understand Medicare step by step so you can make decisions with confidence. Medicare is health insurance for most people who are 65 or older. It is also available to some younger people with certain disabilities or certain medical conditions. Medicare is made up of different parts, and each part covers different things. Let's break them down simply. Medicare Part A is hospital insurance. It helps cover hospital stays, skilled nursing facilities, hospice care, and some home health care. Most people do not pay a monthly premium for Part A if they worked and paid Medicare taxes long enough. Medicare Part B is medical insurance. It helps cover doctor visits, outpatient care, preventive services, and medical equipment. Part B does have a monthly premium. This is the part many people delay by mistake if they are still working and don't check their rules first. Medicare Part C is also called Medicare Advantage. These are plans offered by private insurance companies that replace original Medicare. They often include hospital and medical coverage, prescription drugs, and extra benefits like dental, vision, or hearing. Each plan is different, so it's important to understand how they work before choosing one. Medicare Part D helps cover prescription drugs. This is separate from Parts A and B unless your plan includes it. Not having drug coverage when you are first eligible can sometimes lead to late penalties. Here is an important reminder. Medicare is not one single plan. It is a system with different parts and choices. What works for one person may not be right for someone else. That is why learning the basics first is so important. One of the biggest mistakes people make is waiting too long to learn how Medicare works. Another mistake is assuming their work insurance or retirement insurance automatically covers everything. Before making decisions, it's smart to ask, when should I enroll? Which parts do I need? How does my current coverage work with Medicare? If this feels overwhelming, you are not alone. Medicare sounds complicated at first, but once it's explained clearly, it becomes manageable. Our goal at Simply Senior Plans is to make Medicare easier to understand so you can make confident choices. Subscribe for clear guidance, simple explanations, and updates seniors can trust. We post videos to help you avoid mistakes and understand your Medicare options step by step. This video is for educational purposes only. It is not affiliated with or endorsed by Medicare or the U.S. government. For official information, please visit medicare.gov or call 1-800-MEDICARE.